It's not easy, and like the pain. Hello, everyone. You're listening to Black Girl Sickle Cell Podcast. I am your host, Ayana Everhart. I am a YouTuber, designer, and you guys see Black Girl living with sickle cell. So we're gonna get started with the questions. First question: how would you describe your experience with healthcare system managing sickle cell?
So from the perspective of mom, I can't answer how was it for myself because I don't have sickle cell disease managing the healthcare system. However, as a mom, I can say you as a child dealing with the healthcare system was, easier because I was your number one advocate. I was able to, communicate with the doctor as well, advocate. So I would definitely say there's a disparity with the healthcare system when you're a child versus young adult and adult. So I would just say with that, it's a definite disparity. I didn't have as many issues dealing with it when you were a child because, like I said, I was your best advocate. As I didn't mention, as I introduced myself, I am a social worker by profession, so I have that under my belt as well. But for a mom not having that, you just have to advocate for your child with the healthcare system, and it is easier when your child is a baby because you're there for that support. And I'll talk a little bit more about that later.
Okay, so next question. What does the healthcare system need to do to better care for people with sickle cell?
Again, the healthcare system overall, especially with the people who work in the healthcare system, needs to have a little bit more empathy. Again, as I stated, as a baby, I was able to deal and manage with the healthcare professions. Never really had an issue with medical care as a per se when it comes to coverage, but dealing with the healthcare professionals can be a little overwhelming. However, like I said, when you were a child, I didn't experience that because I was able to help navigate that. But as you became an adult, we struggle with some things within the healthcare system. They do treat older patients with sickle cell a little different, and absolutely based on the color of our skin.
Okay. Next question is, what has been the most challenging part of this journey of being a mom, someone with sickle cell?
Most difficult journey, again, probably right now helping you deal with your adulthood sickle cell. So a lot of you guys following Yana and probably know some of her story. If you don't, you know. If you don't, we'll talk about that in another series or something. But just managing everything that you're going through right now for the last 3 years, helping you get through what you've been dealing with, all related to your sickle cell. This has been the hardest part right now. These last 3 years, helping you manage your sickle cell.
Next question. What do you wish more people understand about sickle cell?
So not to get too in deep, but that you can't get sickle cell by touching somebody. That's one. So again, with sickle cell, to give a little bit of backstory, 2 parents have to have a trait or the disease to carry it to your offspring. If 2 parents have the trait, there's a 25% chance that the offspring may have sickle cell. So again, you can't get sickle cell by being next to somebody or some type of communicable disease in that nature. You have to get it from one of your parents who has the trait or the disease.
What does no one tell you about having a child with sickle cell?
So I'm going to speak again as when you were younger. There's going to be a lot of late nights, helping you manage the pain, how to manage the pain. I mean, some doctors will be there to tell you, do this, do that. But until you're a parent experience it, you're going to have a lot of late nights. What else someone tell me? I don't know. I guess just, to be there, be the support. You're going to do it, like I said, a lot of late nights, helping ease pain. I can't think of anything else right now.
Okay. What are the stereotypes you hear as a mom?
Again, about how you can get sickle cell. People think by, just touching somebody, so no. Also stereotypes that you don't live past a certain age, which is a myth. Like I said, my daughter's about to be 30, living well with sickle cell. What other myths? It is primarily an African American disease, brown and black people disease. However, there are other cultures, races that sickle cell anemia affects.
It's like older people. I had like an 80-year-old lady at it.
Yes, one of our mothers just recently transitioned, Miss Lambright, and she was well in, I believe, into her 80s. Sorry, Nicole, I don't remember her age, but she lived very well with sickle cell.
Okay, last question. What else do you want to share with people about being a mom with sickle cell that you have already said?
One, you can support if you're able to donate blood. I would say donate blood. Sometimes sickle cell patients have to get a lot of blood transfusions, and they need that blood bank. So if you can donate blood, please. Also, bone marrow transplants. So there have been cures for sickle cell through bone marrow transplant. Preferably, one was a case we had. So let me go back to the supports that I had when Ayana was a baby. I had the St. Christopher's Hospital for Children sickle cell support group. At that time, I was a new mom. There was a president. Our future later on became the president until Ayana transitioned into her adulthood. So always have those resources, support as far as networking, like I said, parent support groups to help you. There's the Sickle Cell Disease Association of America, SCADA, also a great resource. So tap into your resources, other parents. Again, with the bone marrow, let me go back. So you have to have a sibling who has the same parents, but that sibling doesn't have the sickle cell disease. They can actually probably be a bone marrow transplant recipient for you. However, there are banks out there where people are donating bone marrow that might be a match for someone with sickle cell. So if you can donate blood and donate bone marrow, so it might save someone's life.
Okay, thank you for joining me on this episode. Thank you.
Thank you for having me.
Hey, thank you everyone for listening to this episode of Black Girl with Sickle Cell Podcast. This will be up Monday, May 19th, 2025 at 10 a.m. Don't forget to like, comment, and subscribe. And tune in to the next episode for the 1 year anniversary. But I also, again, thank my mom for joining me on this episode. And thank you for the love and support. Bye.